Yes, so our next speaker is Associate Professor Rachael McDonald. Rachael is a clinical research and teaching health professional with an interest in enabling people with lifelong disabilities to participate in life situations. She has an interest in using technology as an enabler, but also as a tool for collecting objective evidence, which was a feature of her occupational therapy research. She's also the Disability and Chronic Disease Lead at the Iverson Health Innovation Institute, Swinburne University. Welcome, Rachel.
Thank you. Can you hear me? You can't hear me?
You might have to speak up a bit, sorry.
Okay, I'll do it like that. How's that? Is that better?
Great.
Okay, thank you. And I might share my screen. There. Okay, can you see my can see my slides? Fantastic. Great. Okay. Thank you. That was so fascinating. I got a bit distracted from what I'm supposed to say. But that was great. Thank you very much, Lorraine, for that. Absolutely fascinating. So I'm also one of the reasons why I've been asked is that I'm also the director of the Medtech Vic Hub, which is a centre at Swinburne University, and that's really part of what I'm going to be talking about today. Some of the projects we've done for many years that have culminated in this hub. I would like to respectfully acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional owners of the land in which Swinburne's Australian campuses are located in Melbourne's east and outer east. I'd like to acknowledge and respect the traditional owners of lands across Australia, their elders, ancestors, cultures and heritage, and recognise the continuing sovereignties of Aboriginal and Torres Strait Islander nations. So I wanted to sort of talk about essentially sort of where some of the sort of numbers are in terms of what we're looking at. So Medtech Vic is about enabling technologies, otherwise known as assistive technologies. We use the word enabling because we're actually really wanting to think about putting the person front and centre. And the numbers are fairly big if we just look at disability and ageing. 3.9 million people in Australia living with a disability at the moment. About 4.2 million people are over the age of 65, and I think there's even greater numbers. About 50% of us live with sort of chronic health issues. So thinking about the sort of technologies, both digital and others that we're looking at, and what we can also sort of see is that these are groups that are really underrepresented in digital services. I wanted to sort of just give us a little bit of background. So the World Health Organization has been doing quite a lot of work over the last sort of 15 years, thinking about assistive technologies and the lack of access to them. So why is it digital? Assistive technologies is an umbrella term for any device or system that allows individuals to perform tasks that they would otherwise be unable to do. And so if we're thinking about that, it's actually ubiquitous technologies, emerging technologies, assistive technologies all start to blend into one. What they have in common, though, is that a product, i.e. a kind of hard product, needs digitalized systems and services to support their use. And that's really where some of this comes in. I think also just giving some of the numbers there that from the World Health Organization, first in 2016 and also in May this year, published the kind of the amount of this globally is that there's about 1 billion people in the world with disabilities, and about 93 million of those are children. And there's about, and that those figures are doubling. And of those, about 9 out of 10 people don't have access to the services that they need. So part of this is our addressing this, and that Medtech Vic Hub is a centre at Swinburne that works to support and connect individuals and organisations across the assistive and medical device sector in Victoria. And really our role is to ensure rapid clinical and technical prototyping and manufacturing. We don't manufacture a lot of these enabling technologies or systems in Australia. There's a number of reasons for that. But one of the reasons is that that we haven't, we're relatively small, and that other places, I guess, have been a bit quicker, if you like, to sort of take on the development and the research. But our goal is to bring together individuals with living experience of disability and the people that support them to co-create products and services. One of the things that we do is that's our kind of diagram which shows what we do. And today I'm going to be talking a little bit about our Enabling Technologies platform, because that's the kind of kit, if you like, that's quite exciting in the development. But I'm going to be talking about our challenge projects and our kind of approach, if you like, to co-design and implementation, therefore, of our services and products. And I think one of the really interesting things is that when we actually have done a lot of our co-design, the end products that are being developed are not necessarily products. They are actually digital products, services, and ways of connection. So one of the aims of Medtech Vic Hub, though, is that we're really looking about enablement of people participating. So not necessarily actually access to health per se or health. It's about enablement of participation and about trying to personalize solutions for people to live their lives. The other thing, as I said just recently, was that we don't actually have developed a lot in Australia. We tend to import a lot of our actual products from North America or Europe, and we don't tend to use either locally to our region or to ourselves. So this is an opportunity, and one of the reasons why we got funding from the Higher Education Innovation Fund was to sort of really think about how could we locally develop these kinds of devices and systems in a local sense, because also designing sort of one of the things around the implementation of products and services is having access to them. And as we've also seen, one of the issues that we have from following the last couple of years is that people have not had access to either the products or the services that they've needed. So we're really interested in developing user-focused solutions that enable and enhance our lives. And really key to this are co-created and co-evaluated, as well as useful, accessible, innovative, and manufacturable. But the other thing is that they're desirable. A lot of the types of products that have been developed in this space, or services that have been developed in this space, are not really desirable, not things that people actually want to use, but are kind of prescribed as almost sort of medical devices, which don't then enable, which are not things that people want to use to participate in daily life. So that's our aim, if you like, or our mission statement. So what I'm going to do is just go through a couple of kind of current projects where we're looking at using our Enabling Technologies platform, and then talk a little bit more about some of the learnings we've done around our kind of user focus, if you like. So our Enabling Technologies platform consists really of kind of the physical kit, if you like. We've got one thing which I'm not going to talk about, which is our Assistive Technology Living Lab, and that's a sort of co-creation space that we have on the Swinburne campus. We're in the process of making working with people who are living with disabilities, and also our makers, to make this a fully accessible workshop space. And we also have our kind of more blue sky with the Transformative Media Technologies Centre, which is called a volumetric capture studio. Now, volumetric capture is primarily came from sort of film and animation, and it uses multiple cameras to record 2D or 3D animation and allows the viewer to rotate or move around the end experience. So what we've kind of what we've done from this is that we've got a volumetric capture studio, which is at one of our campuses in Melbourne, and we've developed a method to combine motion capture with that volumetric capture. And what we're actually doing with that is to is to show where people's bodies are in space so that we can really accurately measure, because most of the types of things that we do in terms of some of the sort of allied health clinicians, we use our eyes, we use our thumbs, and we use our judgment. And we're looking at ways that we can really objectively measure this. And this has two advantages. And one of them is that we can develop sort of the skills that we need to be really objective in measuring. But the other thing is that the end user can then actually see themselves and therefore actually be able to interact with the environments around them. And motion capture is a sort of really interesting way of doing this. And we actually, what you can see also here is that we've also developed a bone kit, which is going to be hopefully ready this month, which is a remote app for the objective measurement of bodies. And what you can sort of see is that we've done quite a lot of work. This is somebody pushing their wheelchair, and this is someone where we're actually able to take the wheelchair away so that we can look at what their body's doing in space. So that's the kind of blue sky stuff which is occurring right now. And this is the sort of idea around trying to get people to also see themselves and what their bodies are doing in space. What the sort of second thing I wanted to talk about in terms of our kind of co-design as a VR experience is really interesting seeing Rose's work earlier. And one of the things that we've done here is that at the Transformative Media Technologies Centre, we have designers and artists. So this was a project which is about co-designing VR experiences for remote rehabilitation exercises to see if people could use this in their own home. And I just wanted to highlight that it's been a kind of long co-design process, really, where we sort of started at this point with participant data collection, which is including their experiences, what they felt about an experience, what they didn't like. We then designed a VR experience, got people in, used the system, feedback, collected other kind of objective measurements, reviewed, redesigned, fed back, reviewed, etc., etc. And we're now up to this part of the final testing stages. So these are the kinds of environments that we've developed, and therefore sort of physical, that the aim is for really physical activities that can be remotely delivered. And what have we learnt from this, though, in terms of the in terms of this? And it's one of the things around kind of the understanding of that kind of co-design. What we found is that participants preferred a structure over a non-structured environment. But if we were looking at movement, the participants' movement was more continuous and less episodic in an unstructured environment. So what they liked wasn't necessarily what the aim was. We also found that if we were actually going to be using this in terms of maybe a rehabilitation activity, we needed to design this around the purpose of the activity, not have something that people sort of have to just choose their own adventure. And it needed to have some fidelity, but people needed a reason with meaning for the activity instead of just gamification of something. So it was something around designing the experience as it was. And of course, the ambience of the environment was important. So those are some kind of learnings that we've found. But really the pillar of our work is around the co-creation challenge workshops that we're doing. And the idea is to co-create with everyone in the room. And we really wanted to sort of share with you some of the learnings around around this. We particularly target people with living experience of disabilities, but also all the people and the stakeholders in the environment of those people, caregivers, support organisations, etc. But we also have a great deal of access to designers, engineers, and those kind of things. What we're doing is that we have several active projects, and we're learning from workshops about who needs to be in the room, who doesn't need to be in the room. We're developing lived experience panels for people who we can call on, but more importantly, we're asking people how they want us to work with them. Some of our challenge workshops are actually ambiguous, and that makes many of our researchers feel a little bit uncomfortable. The learnings overall that we've learned from our challenge projects and workshops over recently is that, of course, we had originally designed our workshops to be in person, but they have been online, and actually that's really well perceived. And for the people with lived experience of disability, that's actually it can be often preferred, with some exceptions. In terms of our kind of online workshops, though, we do have a design coach, and we work with a design factory in Melbourne. So using online tools that are typically used in those settings, like Miro boards, are time consuming and difficult for inexperienced users to use, and often challenging for participants with issues to do. So we've all had to adapt, and so we've adapted again according to the people that we're co-creating with. We also found that an experienced facilitator is really important if we're running some workshops with multiple stakeholders in the room. And sometimes we also have to think about, is it the right thing to do to have multiple stakeholders in the room, or should we perhaps have an initial phase where we gather experiences of different groups, and then have a kind of a workshop after that? Or how do we co-create that information? And again, that ambiguity is sometimes quite difficult for researchers. But what we're doing, therefore, is that we're, if you like, considering the needs of the people that we're working with. We do have face-to-face workshops with participants and users who are unable to use online delivery. The insights that we've really had around the recent workshops, and things that people have told us, is to involve people from the start. And you can see some of the quotes there from some recent groups that we ran. I really like co-design because I like to be involved from the start to the end, and I have control over whatever I'm involved in. And that kind of harks back to some of the talks that we've heard earlier in the day about people having some control. And I can give feedback and see how what I've said has been used or put into practice. The other thing that's really important is to be authentic. And that quote there sort of saying, for me, it's about a chance that I want to converse. I don't want to be treated like of an object that just comes in and leaves. And that's really important because, since particularly with the advent of the NDIS and all sorts of things, people are kind of feeling that they actually really need to, are able to express how much they need to be valued and how they want their input to be valued. And that goes on to the next point, which is around valuing contributions. And there are many ways to do this. It was interesting. I took a note down earlier about people talking about how it was difficult to get to comply, or not to comply, but to sort of think about some of the rules around ethics and the rules around valuing people. And it's very difficult to pay participants, even though the participants need to be valued, and we're finding workarounds with that. The other thing is to engage people from diverse backgrounds and in the ways that they will be able to contribute, and being very flexible in our approach to co-designing. And I think this was a quote from one of our participants, that I think if we're really doing co-design, then you're meeting people where they're at. So insights from recent kind of workshops that we've done, working with end users living with disabilities, is to enable participation by understanding and accommodating to individual needs. Again, quite challenging, that it may be that we collect our information in different ways. Very much came across that please don't exclude individuals or groups because they're too hard to reach or too difficult to include. Find ways of including them. So some of the suggestions were make it so that you can participate asynchronously, for example, targeted data collection with asynchronous work otherwise. Thinking about value and about feeling welcome, feeling valued, and thinking about the language that's used, because it's one of the things that that is really, really important is to be able to engage people and keeping that language at the in the way that people are able to participate, and putting mechanisms in place to ensure that all voices are heard, not just the loudest. And the last one is, I think, is really important, is that it's not just the end users that we need to be authentically engaging with. It's the people who are it's the stakeholders and the whole group. So just in summary of those things, when co-designing with end users, it's really important to involve people from the start, to value their contributions and to feedback around outcomes and impact. I'm just going to pause there because you can kind of read some of those quotes, which we've put in before. But these are some of the quotes from workshops we've done around how to do co-design with people with living experience. And so recognizing that everybody's individual, that people actually want to be involved from the start, and that we can meet people where we're at. This is the Centre for Transformative Media Technologies is where some of our enabling technologies platforms are. And it's just a sort of thing that, you know, we can be innovative or disruptive with technology and products and digital health, and we always aim to improve. But if we put the user at the centre of the process, particularly in designing products and services for these particular groups, we can be quite transformative in our products and our digitalisation. Sorry, I'll pause there just as I cough. I'm going to just turn my microphone off for a second. I'm done, Mahima.
Thank you, Rachel. That was wonderful. Thank you. We have a couple of questions in the from the audience, and they've been making some notes as well. So we have questions for you as well. Leah, one of the attendees, is asking, do you think revising the Therapeutic Goods Administration guidelines regarding medical devices registration could encourage more Australian innovation in the space? So, for instance, having a dedicated assistive technology domain, she's thinking designers may be concerned that they would be legally liable if a product fails.
That's a really good question. Most of the, well, it depends on the technology. Many of them fall into a category 1, and therefore they're actually okay. It's really, I mean, I think that it's a multitude. I think, and also there was some revisions not so long ago. I think people are just one of the things that we've found around manufacturers is that previous to the advent of the NDIS, people didn't think there was a big enough market to invest their time and control. So that's certainly an issue that we're sort of now addressing. But secondly, it's things have changed. Do I think revising the TGA guidelines could encourage more innovation? Possibly, but I think that there are other things in the ecosystem that we can change first, is the answer to that, probably.
Thank you. And another audience member is asking that they are keen to hear about the workarounds for remunerating participants.
That's a really good a really good question. So it's actually, and it's also a multiple based answer. One of them is that some of the things that made me see red when I get feedback a little bit from the ethics committee is that I think one of the comments that came back was, if people just have lived experience, we're giving them a voucher. And it was the just have lived experience that made me kind of go back to the Convention on the Rights of People with a Disability, and also, you know, going right back to those sorts of things to right back to the ethics committee and say, actually, and the kind of nothing about us without us. We are able to give honorariums for people, and we've now kind of got through some of those things. But we also have to be very clear on people's roles. And so and so we're very clear that you are giving us your expertise. And so it's actually writing, and it is actually it's not an easy solution, but it's one of the things where we actually address this. We're very clear and address this every time we now put in an ethics committee, and we have about 15 in, so it's not a non-onerous task. But we also kind of put people in different, people with lived experience at a kind of a reasonable wage. Other people will use as consultants. So we actually work around those kind of things. And because from the ethics committee, they're kind of, their kind of coercion thoughts trumps everything else. However, we're not coercing people who actually want to participate, and yet we need to value for their time, and particularly people who haven't been valued in the past.
Wonderful, thank you. As a segue to that, we had a couple of Codesign questions coming from our team here as well. So this is a two-part question. Number one, you mentioned that you use tools like Miro and things, and that's certainly a tool we use in the center as well. I'm curious to hear if you had any tips around creating this environment of safety and authenticity and doing quality co-design virtually. That's one. And then the second part of that is you also mentioned that participants often prefer a more unstructured environment where the creativity can flow. But certainly from my experience in MRFF funded projects and such, there's specific scopes and milestones we need to keep up with. So how do you find the balance between having that creative environment, but meeting the scopes and things?
Gee, that's two very big questions. So the first one is using things like Miro tools and the unstructured environment. And so we actually find workarounds. We've used Miro boards in our sort of design factory with students, and so there was an assumption from people in the team initially that that would just work, and it kind of failed spectacularly. So we've done things like, we have 3 people. We'll have one person running the workshop or the interview. We'll have somebody else. If it's an individual interview, we'll have maybe 2 people, making sure people are very comfortable with that. And we might have one person scribing on the Miro board and using the Miro board as a sort of feedback mechanism. And so that actually, it involves kind of quite a lot of skill, because it involves the person on the end of the Miro board transcribing, but not transcribing immediately, trying to put concepts on. So we use things like that. And sometimes we've thrown the Miro board away, and sometimes we use the Miro board where we check in at little ways. So we actually adapt it depending on the environment. And that means that we actually do a lot of work first around who's going to be in the room, be it virtually or otherwise. There are kind of groups of people who, for whatever reason, we do need to really be in the same room as, and therefore we kind of don't need to use a Miro board. We can use all our other tools. And then the second half of your question was about, with tight deadlines on projects, how do you do it? Mm-hmm. And I think that I guess one of the things is that we do a lot of preparation, but the ambiguity, and we also probably tailor some of that co-design to we kind of try and build that in, and it's almost becoming bilingual. One thing for the granting reporting requirements, and one thing for the data collection. But there's always time pressure, and we're kind of, we've managed to hit all our milestones so far, but it's a lot of effort on our behalf, I guess. And we haven't had this hasn't been part of an MRFF process at the moment. It is really difficult, because I think one of the The comments on the Q&A is medical ethics committees need to enter the 21st century when it comes to inclusion. And I kind of actually think that some of our granting bodies need to also come into the 21st century in terms of being co-designing with end users, because it's, you know, it makes a big difference. It's a little bit kind of easier, if you like, to sell that concept in terms of enabling and assistive technologies, because they're so daggy, for want of another word, and because they are designed for a particular group, it's kind of easy to say, well, you need to design these with the end users. But when you actually see from the kind of products to actually co-designing services and how effective they are with co-designing, and that's not just that we ask people their opinions. Obviously, we need to get the experts. So we have, what I didn't kind of mention, that we have kind of, as part of this, clinical advisors who are clinicians and so on, who are part of the team. And we also have other professionals like product design engineers who are part of the team. So, so there is that, but it's not, there's no easy answer. I guess one of the things that is an answer, though, is that we have a team who are all valuing and wanting to sort of work in this way. So, you know, put the time and effort in. But it is really difficult. You know, we've just had a meeting this week with a new researcher, and they're wanting to put things in boxes because that's how you meet your reporting requirements. And we're kind of say, let's take it out of these boxes. Then we have to put it back in again for the reporting.
Yeah, that's a fair point. And just one last question. It's really a reflection more so, and we wonder if you could talk a little bit about what sort of reforms you think might be needed in terms of ethics committees around understanding that ethics of inclusion piece as well.
That's that's one where you probably don't want to get me started, if you like. Because and I have been on ethics committees for years, and I think that there's some there's a kind of I don't really want to be political, but I do want to say that I think there's really quite a paternalistic view of ethics committees towards people, and their role is for us to actually perform ethical research. And I think there's a kind of overarching view that doing that means protecting the vulnerable. And I think that there's much more nuance to protecting the vulnerable than actually saying you can't do stuff with them or you have to do it in this way. And I also think that that one of the things that we really need to think about is what the role of really of research is. And it's ironic that it's much easier where you can, you know, to poke things at people than it is to ask people around the things that value to them. So I think that there really needs to be this the inclusion and potentially co-designing with end users of research around ethics, and to make, you know, to ensure that we're meeting people where they are. And I think being very clear about that, it feels like sometimes ethics can be this tick box exercise. It's seen as an issue. I really like ethics because it makes us do ethical research, but then it gets conflated with the things like, you know, we've had some of our applications rejected because some people with disabilities have been seen as a vulnerable group, even though they're not one of the vulnerable groups, but they're a vulnerable group because they have disabilities. And so we've then kind of had to go back and use the UN Convention on the Rights of People with Disabilities and argue about people being there. So I think actually sort of really a kind of, I think a revision around real life and who participants are, and being clear, you know, because we're you know, beholden to fill in the form that is a generic form. There's not a, you know, an argument. And I have been been known in the past to actually write screeds on the, you know, the last bit you can do on why this is important, why we've included people. I don't think that answers your questions, but I could go.
No, that's a great start.
Yes.
You've given us some food for thought. Thank you. Really appreciate it. And I think that's a good way, good time to end this part of the session as well.